We then looked at quality of life. And the reason for that was this is the patient's perspective and the family's perspective of what it means. And true quality of life is really difficult to measure because it's not just looking at, walking, talking, and what you can do, but the effect on the family, the spiritual side, the emotional side, social functioning, how are you out there in society. And it changes with age. What matters to a 3-year-old is different from what matters to a 14-year-old to an adult. So you need to adapt it. So we did something that's called health-related quality of life, and this looks at the impact of the disease and its treatment on the family and their life. So we had it filled by the patient or the parent, and can they get around? Can they get across the street by themselves? If they're in a quiet room, can they hear? Can they hear in a busy room? Can they hear if they're on the street outside? How far can they see? What do they think they look like? It's really weird, but do they think they look all right? Are they attractive to the opposite sex? Are they confident about themselves? Would they go out, dressed for an out and party, or do they just hide at home? And how much can they do for themselves? And it ranged from sort of near normal to quite severely affected. But at least half of them, more than half of them, felt that LCH had adversely affected their life long term. It was obviously worse in those with brain and lung damage. But the fascinating thing was the one with the most severe IQ actually felt they were doing really well. And they were fine. I mean, these were the children who couldn't look after themselves at all, and actually had very severe bone problems, looked quite abnormal, and their face looked very different. But I guess there's a good side to it. Because they had such low IQs, they thought they were great. And he thought he was gorgeous, and I said, yes, you are, you drop dead gorgeous. And to me, you always will be, but that's the difference. And the parents, of course, who are out there watching them, realize that actually it's much worse than the children realize it is. What we were pleased was it correlated very closely with the doctor's score. So the ones who had the worst quality of life were the ones that the doctors also picked up as being the worst affected. So in some ways, we're getting it right, and we have some idea what we're doing. So the sequelae are significant in about more than half, if you put the moderate and the severe together, and it's disease-related. That's the difference between LCH and, say, leukemia. In leukemia, the long-term consequences are what the doctor have done. It's the treatment that's done it. In LCH, nowadays with the treatment, the majority of the problems are disease-related. Bony and skin changes are the most common. Damage is permanent, and the brain damage results in handicap, which can't be cured, but can be helped, and the quality of life is affected. So it's really important to do a regular clinical assessment, check growth, check puberty. You might have to do these investigations, depending on what's wrong with the child. And I think that's really helpful. And treat every bit as it goes. And I think the most important thing is don't let them discharge your child, or you, as an adult, when they think the disease is cured. Make sure someone is keeping an eye on you.